Today's GutFlix topic pertains to the burning sensation in your chest after a meal or a feeling of sour taste creeping up your throat, commonly termed as acid reflux. In medical terms, this is often referred to as gastroesophageal reflux disease or GERD. Starting with the basics, acid reflux occurs when stomach acid flows back into the esophagus. The esophagus is the muscular tube connecting your mouth to your stomach. It's normal to have a little acid reflux now and then, but when it becomes frequent, it's known as gastroesophageal reflux disease, or GERD. Normally, a valve at the bottom of the esophagus, called the lower esophageal sphincter, acts as a barrier to prevent this acid from rising. But when this valve weakens or relaxes abnormally, stomach acid can escape, causing that burning sensation we know as heartburn. What causes acid reflux? First, certain foods are notorious for triggering acid reflux. These include spicy foods, acidic foods like citrus and tomatoes, chocolate, coffee, alcohol, and fried or fatty foods. Eating large meals or lying down right after eating can also contribute to acid reflux. Other risk factors include smoking, being overweight, pregnancy, and stress. Even certain medications can relax the esophageal sphincter or irritate the esophagus, making reflux more likely. So if you're prone to heartburn, it's important to know your triggers, which may be unique to your body. Symptoms of acid reflux. Heartburn is the most common symptom of acid reflux. Besides heartburn, you might also experience regurgitation, where food or liquid comes back up into your mouth, leaving a sour or bitter taste. Other symptoms can include bloating, burping, hiccups, and difficulty swallowing. Some people even experience chronic cough, wheezing, or hoarseness, especially in the morning. This is because acid can reach the throat and affect the vocal cords or airways. These symptoms can range from mild to severe, and when acid reflux becomes frequent, it can lead to complications. Complications of chronic acid reflux. If you're experiencing acid reflux on a regular basis, it's important to manage it properly, because chronic acid reflux can lead to more serious health issues. Over time, the acid can damage the lining of the esophagus, leading to inflammation and a condition called esophagitis. If left untreated, it can even cause precancerous changes known as Barrett's esophagus, increasing the risk of esophageal cancer. That's why it's essential to recognize the signs early and take steps to manage your symptoms before they worsen. It is important to know that sometimes the degree of symptoms may or may not correlate with the degree of acid reflux. Managing and preventing acid reflux. Let's break it down into some practical tips. First, start by making small adjustments to your diet and avoid common triggers like spicy foods, caffeine, and high-fat meals. Instead, focus on eating smaller, more frequent meals throughout the day, rather than large portions. Another simple tip is to avoid lying down right after eating. Try to stay upright for at least 2 to 3 hours after meals to prevent acid from creeping up into the esophagus. Raising the head of your bed by about 6 to 8 inches, making use of gravity, can help prevent nighttime reflux. If you're overweight, losing even a small amount of weight can reduce pressure on the stomach and lessen reflux. Quitting smoking and reducing alcohol intake are also crucial steps in reducing acid reflux. Medical treatments for acid reflux. If lifestyle changes aren't enough, there are medical treatments available for acid reflux. Over-the-counter medications, like antacids, can neutralize stomach acid for quick relief. H2 blockers like famotidine and proton pump inhibitors like pantoprazole, or PPIs, reduce acid production and provide longer-lasting relief. Always consult your doctor before starting any medication, especially if you're relying on them frequently. In more severe cases, surgery may be an option to strengthen the lower esophageal sphincter if there are any anatomic reasons leading to acid reflux. If you found this video helpful, be sure to like, share, and subscribe to the channel for more health tips.